Wiggle, wiggle, wiggle.
For the past 7 months, Vivi's been keeping mom, Caitlin Williams, on her toes.
She's always been a very active little girl.
Soon after finding out she was pregnant, Caitlin was at her doctor's office.
I had previously had a miscarriage prior to this pregnancy, so right when we found out we were pregnant, we kind of went in to do appointments, just start blood work.
Regular checkups helping ease her anxiety after miscarrying.
Yes, absolutely, and just making sure everything was going right the next time.
But a new federal report from the CDC found fewer women are seeking out prenatal care in their first trimester, dropping from 78% in 2021 down to 75% in 2024. And the number of women getting late or no prenatal care is on the rise.
That's shocking to me. I'm very much I want to get in as soon as possible. I want to see the baby as often as possible. I want to make sure everything's okay.
Putting off prenatal care is a trend Dr. Kim Hildner-Murphy is seeing in Denver.
I do know that we've had a lot of people entering later into care.
Dr. Hildner-Murphy says why is less clear.
I think it's probably a lot of reasons.
She says part of it may be patients trusting doctors less post-COVID. For some, it's cost of care. Others assume early care is less critical or get discouraged since doctors typically don't start care until 8 weeks.
I definitely think it's concerning because there's so much that we want to act on early if we can.
Dr. Hildner-Murphy says early care is critical for testing and assessing health and risk factors.
Pregnancies do not always end in a healthy vaginal delivery or healthy term C-section. A lot of times they end in miscarriage. And learning about what happened with your miscarriage can help us to guide your future prenatal care.
Care that's made all the difference this time around for Caitlin and for Vivi.
There's a lot that can go wrong in pregnancy, delivery. I mean, it's a scary process. Things change in an instant. You never know what's going to happen. So.
Dr. Hildner-Murphy says turning that trend around should center around education and making sure women know the importance of prenatal appointments, making them feel worthwhile. She's designed a whole curriculum to help teach women on different topics as they come in for appointments to make sure that they're getting as much out of their appointments as they can.
That baby was really cute.
And the information important, we
The
hope.
information is also very important, of course. It's interesting for all the different reasons women may have, but.
Yeah, absolutely. And so critical because those early appointments are just vital to making sure they're able to catch stuff really fast.
All right, Rachel, thank you.